For anyone with chronic plantar fasciitis, the morning routine is a struggle. You swing your legs out of bed and prepare for that sharp, stabbing sensation during the first few steps. By the afternoon, the fatigue from simply standing makes it difficult to finish the workday. You have likely already cycled through the standard options. You have spent money on custom insoles, dedicated time to daily calf stretches, and rolled your foot over ice every night, only for the pain to return the moment you resume normal activity. There is a specific reason these efforts stop working. The thick band of tissue called the plantar fascia is trapped in a cycle of irritation. Despite your home care, the natural healing process has stopped. On this chart, we see what happens when standard treatments fail. As the months pass, your progress reaches a flat line. This flat line represents a biological deadlock. The body stops sending signals to repair the tissue, essentially giving up on fixing the area. This is where extracorporeal shockwave therapy, or ESWT, comes in. It is a clinical escalation designed to restart that failed repair process. The treatment uses a handheld device to push sound-based pressure waves through the skin. It uses raw physical energy to force a tissue reaction. Clinics often market this as a high-tech cure, but before you invest in a series of sessions, you need to understand how the biology actually responds to this energy and where its limitations lie. During a session, a provider applies gel to the heel and moves a device over the skin, delivering controlled pressure waves directly into the most tender part of your foot. This energy is used to create microtrauma in the fascia. By causing a small amount of new damage, the treatment deliberately provokes an inflammatory response. As pulses hit the irritated node, they force a reaction. A sudden rush of blood flow floods the tissue. That circulation breaks the stall phase, providing nutrients and oxygen to initiate a new biological repair cycle. This process relies on your own body's ability to heal. No chemical numbing legions or cortisone are used. The trade-off is the sensation itself. Because the waves are targeting sensitive tissue, the procedure can feel intense. The discomfort is temporary, usually lasting just a few minutes. Most clinics can adjust the device's intensity based on your tolerance. This sensation is not a side effect. It is evidence that the machine is delivering enough energy to wake up a dormant healing system. Not all shockwave therapy is the same. Clinics use two different types of technology depending on exactly where and how your foot hurts. This matrix compares radial and focused shockwave therapy. Radial shockwave disperses energy outward in a broad cone, covering a wide area as waves enter the foot. This makes it effective for diffuse pain across the arch or wider heel, but it cannot reach deep targets. Focused shockwave therapy instead channels energy into a concentrated, deeper target. This concentrated energy is the preferred choice for treating specific lesions or deep points of pain, like those caused by heel spurs. The risk with focused therapy is that it can miss the intended target. If your pain is spread across the whole fascia, a pinpoint of energy won't address the surrounding area. You must match the technology to your symptoms. Choosing the wrong format will result in a poor outcome for your investment. The primary reason patients fail to see results has nothing to do with the machine. It happens when they expect the technology to work while they skip their responsibilities at home. On this graph, the dotted line shows expected instant relief. The solid line shows reality, a jagged downward trend over 12 weeks. The initial upward spike is normal, meaning the body is responding. True tissue remodeling is gradual. It takes several weeks for the new biological structure of the fascia to strengthen and for the pain to subside. A common mistake is returning to high-impact sports the moment the foot feels slightly better. Overloading the tissue while it is in this active state of repair reverses progress and extends the time you spend in pain. Success requires non-negotiable homework. You must stay consistent with daily calf mobility, stretching routines, and wearing supportive footwear. If you continue wearing the shoes that originally irritated your foot, the problem will return. A machine cannot fix the effects of unsupportive footwear. Shockwave therapy does not replace physical rehabilitation. It simply creates the biological environment where that rehabilitation can succeed. How do you decide if you should move forward with a clinical consultation? This decision tree determines eligibility. If pain started under 6 weeks ago, stick to rest and ice. It's too early for shockwave. If pain has lasted months and basic care failed, you're an ideal candidate. But without daily rehab, reconsider. The therapy requires participation. For a patient who is stuck but ready to commit to the work, Shockwave therapy powerfully restarts the healing process without surgery. Before you begin, ask your provider about the recommended number of sessions and if other therapies like stretching guidance are included. Clinics like Core Chiropractic Center in Southfield, Michigan, focus on a comprehensive evaluation. Always ensure your provider is looking for the underlying cause of the strain rather than just treating the symptom. Lasting relief isn't found in one session. It comes from a partnership between clinical technology and your commitment to the long-term health of your feet.